hello everyone, this is Vamshi. So, in this video, we will see some of the basic questions. So, the first question is the risk of communicable diseases in higher in children. Okay, so among the children, which age group are higher, okay, more prone to get communicable diseases? Options are infants, preschooler, toddler, school children. So the right one is option D, school children. Why? Because the school children are going to the outside. Okay, they go for the schools and they go for the ground for playing and they mingle with the friends and everybody. So these school children are more prone to get infections, and also these children are less knowledge regarding the some hand hygiene and some protective measures to follow to stop the communicable diseases transmission. So these school children are more prone to get communicable diseases. So option D is the right one. The next question is epithelial tissue present in urinary bladder. So in the renal system, the kidneys, ureter and bladder. So in the bladder, which type of epithelial tissue will be present? Options are squamous, columnar, ciliated, transitional. So the right one is option D. Option D is the transitional. So transitional epithelium will be present in the urinary bladder. Next one is characteristic feature of pyloric stenosis. It is a common question. You can give the answer. Options are projectile vomiting, jelly-like stool, watery diarrhea, and constipation. So the right one is option A, projectile vomiting. So due to the pyloric stenosis, for example, maybe it is a stomach. Okay, pyloric antrum will be present here. Okay, so due to the stenosis of pyloric antrum, what will happen? The food particle which is present in the stomach, it will be regurgitated to the esophagus and vomiting. Okay, so due to the stenosis of the pyloric antrum, the symptom is the characteristic feature of the pyloric stenosis is projectile vomiting. The right answer is option A. The next question is which diagnostic test is performed for RH incompatibility? So RH compatibility and incompatibility we will check for the mother and fetus. Okay, otherwise person and person. So how we can diagnose that these tests? Options are indirect comb test, direct comb test, blood grouping and sedimentation. The right one is option A, indirect comb test. So in this indirect comb test, we can find out the antibodies in the bloodstream. So this we have direct comb test and indirect comb test. So in the direct comb test, antibodies will be present or stuck to the surface of the red blood cells. So for example, this is a red blood cell. So on this surface we can find out the antibodies. Okay, so antibodies we can find out on the RBC. So to find out, to see this kind of this type of method is known as direct combs test. And when come to the indirect combs test, so in this method we can find out the antibodies floating freely in the blood. So in the blood we can find out the, okay, maybe it is a blood. So here we have some RBCs like this. Okay, so in this indirect method we can find out the antibodies freely floating, freely moving in the blood. Okay, so this type of method is known as indirect Combs test. So the next one is HPV is responsible. Okay, so HPV is nothing but human papilloma vaccine. Okay, otherwise, sorry, it is not vaccine, it is virus. So human papilloma virus is responsible for what? Options are uterine bleeding, abortion, cancer, all of the above. So the right one is option C, cancer. So this human papilloma virus can cause for the occurring of cancer in the female's reproductive system. So when they have the cancer, they may have the uterine bleeding. They are risk for the abortions. Mostly they won't get the pregnant, of course. Okay, some of the clinical features also we can find out in the case of cancer. So the right answer is human papilloma virus is responsible for the occurring of cancer. The next one is the TB drug causes red color urine. So among these four drugs, which is responsible and which is caused for the red urine, okay, red color urine? Options are rifampicin, isoniazid, ethambutol, streptomycin. The right one is option A, rifampicin. So rifampicin is a drug, it's a cause for the occurring of red color urination for the TB patients. Okay, so rifampicin, isoniazid, these are all the drugs we can use for the to prevent the tuberculosis. The next one is a drug of choice for alcohol withdrawal symptoms. So please understand the question, drug of choice for alcohol withdrawal. Okay, alcohol withdrawal. So options are disulfiram, naloxone, naltrexone, chlorhexidine. The right one is option D, chlordiazepoxide. Sorry, chlordiazepoxide. So these drugs we can use for the patient with withdrawal symptoms. So for in the case of withdrawal we can use this drug. Otherwise, alcohol dependence, in that case we can use disulfiram drug. The next thing is all of the following drugs are indicated in anaphylactic reaction except one. So please see the question. Okay, whenever we see the except, where we should find for the wrong thing among the four options. So the options are adrenaline, salicylate, antidote, or corticosteroid. The right one is salicylate. So salicylate drug we cannot give in the case of anaphylactic reactions, but adrenaline and antidote corticosteroids, these are the drugs we can use in the case of anaphylactic reaction. Anaphylactic reaction is nothing but when the infection is higher. Okay, when the infection is higher in the human body. Okay, so it can leads to the a severe antibody antigen reactions. So they will happen the antibody antigen reactions, it goes to the anaphylactic reaction. The next question is the first human hormone produced by DNA technology. So in the DNA technology, first human hormone. So which of the hormone is produced by the DNA technology? Options are insulin, estrogen, thyroxine, progesterone. So the right one is insulin. So insulin we can use for the diabetic patients. Okay, so when they doesn't have the sufficient insulin in their body, we will give the insulin hormone externally. So this hormone is identified by the DNA technology. So the next thing is a 100 crore vaccination completed in India in which date? Options are 19th October, 20th October, 21st October, 12th October. The right one is option C, 21st October. Okay, so this is in the year of 2021. So in the year of 2021 and October 21st, we have 100 crore vaccination is completed in the India. So the next one is a endoscope is sterilized by. Okay, so endoscope is a tool how we can sterilize this endoscope after the diagnostic method after using it. Options are radiation, glutaraldehyde, formaldehyde, ethynyl oxide. So the right method is option D. Ethynyl oxide we can use for sterilize the endoscope. So sterilization is nothing but killing of all the pathogens and spores or some eggs or some of the particles which are related to the pathogens. So that is sterilization. So endoscope we can sterilize by the using of ethynyl oxide. The next one is a first indigenous vaccine of could launch in the India. So first indigenous vaccine was launched in India. Options are Covaxin, Covishield, Sputnik and Merinda. So the right one is option A, Covaxin. So Covaxin is a vaccine which is indigenously first generated in the India. Okay, launched in India, that is Covaxin. So this vaccine used for the prevent the COVID-19. The next one is stall-worthy sign is seen in. Options are hydatid mole, placenta previa, preeclampsia and eclampsia. The right one is option B, placenta previa. So in the case of placenta previa, we can find out this stall-worthy sign. So this stall-worthy sign we can see by the pressing of our hand. Okay, so pressing of head down into the pelvis and prone to recover the release of pressure. So by pressing the hand, by pressing the head of head down head down of the fetus. Okay, so it leads to the decreasing of fetal heart rate. Okay, by using this by pressing this we can observe the slowing of the fetal heart rate and it will released by the when we remove the hand on the abdomen. So it means the posterior placenta previa we can identify. So stall-worthy sign is present in the case of placenta previa. Stall-worthy sign is placenta previa. The next one is carpopedal spasm is seen in. Options are hypokalemia, hyperkalemia, hyponatremia, hypernatremia. The right one is option A, hypokalemia. So in the case of less calcium level in the blood, we can see the carpopedal spasm. So this spasm, it is nothing but it is a involuntary muscle contractions. Okay, so in the hand and feet, it is nothing but carpopedal spasm. The last one is the CUT 380 is effective for. So this is a contraceptive method Okay, so this method is effective for how many years? Options are 5 years, 3 years, 10 years, 8 years. The right one is option D, 8 years. So 8 years it is effective for CUT 3IT. Thank you for watching.